Like most diseases, cystic fibrosis can make you sick, but unlike most diseases, it will literally take your breath away. Unlike diseases such as pneumonia or jaundice, cystic fibrosis, or CF for short, is a genetic disorder. It's not contagious, it's something that runs in the family, but we'll talk about that later. Cystic fibrosis simply changes how two elements behave in our body, the positively charged sodium ion and the negatively charged chlorine ion. This is your skin, and underneath your skin you have sweat glands, and inside the pores there is a high concentration of sodium and chloride solution, and this makes up your sweat. Normally what should happen when sweat is secreted is that the chloride ions will get reabsorbed by the body along with the sodium ion because they attract each other. This happens through a transmembrane protein called CFTR. This is because both sodium and chloride are valuable resources in the body, so it generally tries to preserve and reuse it. In a person with cystic fibrosis, this CFTR transmembrane protein is absent. So a CF patient, when they sweat, the body drains away all the chloride and sodium present. The major health complication that arises from cystic fibrosis all stem from the absence of the CFTR protein. Every major organ in your body is coated with a thin lining of mucus to protect it from bacterial infections. The mucus requires a constant supply of chloride and sodium from its surrounding cells so that water can mix with the mucus through osmosis. Otherwise, the mucus gets dry, thick, and viscous, harder for the body to move it around and clean. Due to the lack of CFTR proteins in CF patients, their mucus lining is very thick and it often prevents the organs from functioning properly. Let's look at our lungs. If the mucus lining is left unclean, bacteria is able to colonize in the lungs, causing bacterial infections. This is why CF patients often suffer from pseudognoma, a type of pneumonia, repeatedly, and this is often lethal. The pancreas and the liver are also affected. The thick mucus can block the pathways of enzymes and bile. This means the patient cannot absorb nutrients from foods, making them malnourished. Due to these complications, the average lifespan of a CF patient is around 35 to 40 years in the UK and the US. In developing countries such as India, El Salvador, and Ethiopia, the life expectancy can be as low as only 15 years. Recent epidemiology reports suggest that people of European descent are more likely affected by CF. About 1 in 3,000 people has the disease. Africans, 1 in 15,000, and Asians with the lowest, with 1 in 30,000. Now, let's look at some of the symptoms of cystic fibrosis. Patients of CF often have very salty skin. This is due to the abundance of sodium and chloride ions that were dumped from the sweat glands. Those affected will also suffer from wheezing and shortness of breath because thick mucus can interfere with the gas exchanges in the lungs. This means patients cannot get enough oxygen from each breath. This can also lead to frequent lung infections such as pneumonia and bronchitis. You might remember from earlier that cystic fibrosis can prevent bile to be secreted by the liver. Without bile, our body cannot absorb vitamin D because it's a fat-soluble vitamin. Our body needs vitamin D to absorb calcium. So, no bile means no vitamin D and no calcium. Well, it turns out our body needs calcium to keep our bones healthy. So many CF patients can often suffer from osteoporosis, and they are also malnourished despite healthy diet. To diagnose a CF patient, a doctor might perform a sweat test where they are testing the amount of salt in the sweat. If someone has a high concentration of salt in their sweat, they are likely to have cystic fibrosis. The doctor might also want to look at the patient's pedigree, which can help him or her accurately determine the probability of the patient having CF. If the patient suffers from malnutrition, poor growth, or weight gain, it could indicate the presence of CF. After a sufficient amount of evidence, the doctor will take a chest or abdominal X-ray. The lungs and pancreas of a CF patient are covered with cysts, which is a result of lung infections. This is where cystic fibrosis gets its name. In a newborn, the meconium, which is the baby's first stool, gets very thick and sticky and can often get stuck in the baby's intestines. This is called a meconium ileus, and it is a surgical emergency. With our current understanding and technology, cystic fibrosis is not curable, as it is a genetic disorder. In the future, we might be able to edit our genome, which will allow the deletion of cystic fibrosis gene. For now, there are only temporary medications to control CF symptoms. For problems that occur in the gastrointestinal tract or the digestive system, patients must take enzyme pills routinely. These pills help supplement the lack of enzyme in the digestive system and help the patient absorb nutrients properly. For lung infections, doctors suggest anti-inflammatory drugs and antibiotics. As cystic fibrosis patients can't properly reabsorb salt, they must take a lot of salt in their diet. To take care of mucus in their body, CF patients must use a high-frequency chest wall oscillation vest for 20 minutes every day. The vest mechanically shakes off excess mucus, allowing the patient to breathe normally. CF patients are born with the disease. They have lived with it their whole life, and so the treatments themselves becomes a part of their life. Parents of CF patients have to do much of the heavy lifting. Parents must start treatment immediately after their son or daughter has been diagnosed. It is emotionally painful, especially for the parents, to watch their son or daughter suffer and knowing they will never live a normal life. CF patients have to live a dual life, one where they take care of themselves and the other where they participate in various social events. Cystic fibrosis doesn't have any effect in the patient's physical appearance, allowing them to have a normal social life. Cystic fibrosis medication costs around $16,000 annually. In the US, lifetime healthcare plans for CF patients cost around $300,000. In this portion of the video, we will talk about genetics, specifically how someone gets cystic fibrosis. As mentioned before, cystic fibrosis is a genetic disorder, but to a geneticist, it's an autosomal recessive disorder. Autosomal refers to the first 22 pair of chromosomes in humans, and the 23rd being the sex chromosome. It's autosomal recessive because the gene that causes it is recessive, and because both male and females can potentially be carriers of the trait. So, cystic fibrosis is a result of a mutation in our gene, the most common one being delta F508 mutation. The delta represents a deletion of a nucleotide, which is the 508th amino acid, represented by F, or Phe, short for phenylalanine. Again, cystic fibrosis occurs when the 508th amino acid, phenylalanine, is deleted from the CFTR gene. This is also known as a frame shift mutation. Now, let's look at a few Punnett squares. Here, capital C represents a good copy of the CFTR gene, and a small c represents a bad copy of the gene, i.e. cystic fibrosis gene. Now, let's predict what will happen if a heterozygous father and a heterozygous mother has kids together. Their child will have a 25% chance of getting cystic fibrosis, a 50% chance of carrying the bad copy of the gene, and a 25% chance of not having the bad gene at all. Geneticists call this a 1 to 2 to 1 genotypic ratio. In other words, there is a 75% chance that their child will not have cystic fibrosis at all, i.e. a 3 to 1 ratio, and this is the phenotypic ratio. Let's look at what happens if a homozygous dominant father has kids with a heterozygous recessive mother. Notice how the mother's genotype is c. This means the mother has cystic fibrosis, and we want to know if our child will get it too. Amazingly, none of our children will have cystic fibrosis. However, all of them will carry the bad copy of the gene. It won't affect them in any way, but there is a possibility that they might pass it on to their children. Hopefully by now it should be clear that in order for someone to have cystic fibrosis, both of their parents must have at least one copy of the recessive gene. To further illustrate this point, let's look at a pedigree. As you can see, person 1 is heterozygous and person 2 is homozygous recessive. They have 3 children, out of which only one has cystic fibrosis. Notice how the children of person 3 and 4 and the children of person 6 and 7 are different. None of person 6 and 7's children will have cystic fibrosis because their father is homozygous dominant and does not carry the bad copy of the gene. Person 3, however, does carry the gene, leading to one of her children having CF. Cystic fibrosis is a serious problem and it's incurable. However, researches done on genetic engineering might give us a solution. Technologies like CRISPR can allow us to delete certain genes that are harmful to us. Unfortunately, we still have much to learn about genes and how they function, so we're still a long ways away from curing CF. Cystic Fibrosis Foundation is a non-profit organization in the United States and one of the largest and known representatives of CF patients. Their goal is to provide help to CF patients financially, emotionally, and informatively. Their website lays out steps for parents on how to take care of their child in different stages of their lives. They also provide links to recent researches on cystic fibrosis, some of them funded by the organization itself. They are also a huge proponent of school teachers getting special training on how to work with students that have CF. Cystic Fibrosis Foundation has at least one help center in each state every 200 miles. Cystic Fibrosis Trust is another organization based in the UK that provides detailed, informative support for CF patients and their parents. They also have a helpline that can immediately answer questions regarding CF diagnosis and its treatment. The links to these and other helplines will be provided in the description below. Thanks for watching.